Volvulus. A volvulus is defined as a loop of intestine which is twisted around itself, creating a knot, resulting in a bowel obstruction. In functional obstruction, there is no physical barrier, but there is lack or absence of peristalsis. Signs and symptoms. Typical presentation is crampy abdominal pain, abdominal discomfort with distension, nausea, vomiting, obstipation, which is severe or complete constipation, loss of appetite, inability to pass flatus. Many of these patients have a history of prior abdominal surgery, abdominal neoplasm or hernia. Bowel dilatation causes increased secretions that causes accumulation of fluid in the proximal bowel and increases peristalsis. In severe cases, bowel distension induces edema within the walls of intestines that results in significant fluid shifts. This results in hypovolemic shock, electrolyte imbalance, acidosis, gut perforation, and peritonitis, bowel perforation, which may be due to increased intraluminal pressure. In severe cases, the arterial supply to the bowel is compromised either because of severe edema or physical obstruction of mesenteric blood vessels, which result in bowel wall ischemia and necrosis. Severe septic shock is also seen due to gut bacteria, moving from the gastrointestinal tract to extraintestinal sites such as the mesenteric lymph node complex, liver, spleen, kidney, and bloodstream. Diagnosis. As always, a thorough history is of paramount importance. History of prior intestinal obstructions, abdominal surgeries, hernias, cancer, and opiate use point to possible intestinal obstruction. In addition, fever, tachycardia, hypotension, and tachypnea are usually present. Laboratory tests. Blood tests are not specific and cannot diagnose intestinal obstruction on their own. However, they may reveal dehydration, acidosis, renal failure, and raised inflammatory markers. Imaging. Although plain abdominal x-rays, both in erect and supine position, are often acquired as first line of investigation, CT scan abdomen is the investigation of choice in case of suspected intestinal obstruction. CT has 70 to 90% sensitivity and specificity, can often diagnose exact site and type of obstruction when plain radiography is not helpful. CT can possibly show the exact cause of obstruction, such as a tumor or hernia. Other than that, pneumatosis, bowel wall thickening, or portal venous gas are not visible on plain x-rays. In simple word, CT can tell the transition point, possible etiology, severity of obstruction, assessment of any complications. However, plain x-rays are useful to diagnose dilated bowel loops, and if the x-ray is acquired in erect position, multiple air fluid levels are seen, which traditionally have been a diagnostic feature of bowel obstruction. The erect abdominal x-ray are now obsolete in many x-ray departments. Ultrasonography. Ultrasound is also being used and is becoming a valuable tool with many advantages, although it may not be a suitable tool for every patient. Pathophysiology. In mechanical obstruction, the bowel proximal to the point of obstruction initially increases peristalsis to relieve the obstruction, but eventually becomes dilated, which reduces peristalsis. This causes paralysis of the proximal bowel. Dilatation of the proximal bowel is caused by gas, which is produced by aerobic and anaerobic bacteria and by the fluid from digestive juices. The bowel distal to the obstruction functions normally until it becomes empty, with absorption and peristalsis, at which stage it collapses. The patient eventually becomes dehydrated and loses electrolytes, which is because of reduced oral intake, vomiting, decreased intestinal absorption, and transudation of fluid into the peritoneal cavity. If the condition is not treated, strangulation occurs, which is a serious complication. Strangulation occurs when the blood supply is impaired, resulting in ischemia and infarction of bowel, which means a portion of the bowel becomes dead. Differential diagnosis. Ascites, mesenteric ischemia, perforated viscus, intra-abdominal sepsis, postoperative paralytic ileus, pseudo-obstruction. Medications. Tricyclic antidepressants, narcotics.